Before you flush, check the shape. One pattern near the end of the scale is easy to excuse for weeks, and that is exactly why people miss it. The middle range is usually the calm zone, formed, soft, easy to pass. Looser stool can mean things are moving too fast. Drier, harder stool can mean things are lingering too long. But the final warning is not about one weird bathroom trip. It is about a shape that keeps coming back. We will get there fast, but first you need the baseline. The map is the Bristol stool scale, a 7-picture chart clinicians use so nobody has to guess what soft, hard, or normal means. The key idea is timing. If waste moves quickly, the colon may not pull back enough water. If it moves slowly, more water can be removed and stool gets firmer. So read the scale like a clue, not a verdict. Middle first, then the loose end, then the dry end. And keep this in mind early. The most important sign is not the strangest single shape. It is the one that repeats and no longer matches your normal. Baseline first. The least suspicious stool is usually a smooth, soft log or a sausage shape with light cracks. Not glamorous, but useful. If it happens after breakfast, passes without straining, urgency, or pain, that is usually normal variation. A little softer can still be ordinary after extra coffee, fruit, a large dinner, or a nervous morning. The point is not to inspect every bathroom trip like a crime scene. The point is to know you're normal. Once the shape drifts away from that middle zone and stays there, the case changes. The first shift can look harmless, until it starts falling apart. The loose end often starts with soft blobs, instead of one formed piece. That can mean stool is moving through a little faster, with less time for water to be absorbed. Then it becomes more obvious. Mushy, ragged, or breaking apart the second it hits the water. If it turns watery, urgent, or sends you rushing to the bathroom right after coffee or a meal, that is the faster moving end of the chart. Once in a while this happens. Repeated episodes deserve more attention, especially with pain, fever, blood, or signs of dehydration. But speed is only one trap. The quieter warning sits at the other end. Slowdown usually does not announce itself dramatically. Maybe you skip a day, then 2. Maybe you sit longer, push harder, and still feel unfinished. The stool may look drier, lumpier, or more cracked than your usual. The reason is simple. The longer stool sits in the colon, the more water can be pulled out of it. Less water means firmer, rougher stool that is harder to move. This is where people often miss the clue. They notice discomfort, but not the direction the shape is taking. Dry is one thing. Small, hard pieces are another. And right after that comes the warning shape people are most likely to explain away. Here is the line. Not one strange bathroom trip, but a repeating shape. A stool that is a little dry or cracked after travel. A long day, not enough fluids, or holding it in is usually not the mystery we are chasing. More concerning is stool that breaks into small, hard chunks, like you are pushing out gravel. That can point to slower movement through the colon. The warning category is when this keeps showing up as tiny, very hard pellets, like rabbit droppings, day after day. And there is another version people miss. Stool that becomes persistently very thin, ribbon-like, or flattened compared with your usual. Sometimes that can happen when stool is passing through a narrowed or restricted space, or when the bowel pattern has changed in a way worth checking. One episode is not a diagnosis. A repeated pattern is the signal. Use the scale without panicking. A single change after travel, stress, alcohol, a huge meal, or not enough water is usually noise. Notice it, then move on. What matters is the same zone showing up again over several days. Use your notes app. Shape, how often you go, straining, urgency, pain, and what changed in your routine. The decision point is persistence. If the pattern keeps landing at the uncomfortable ends of the scale, especially with blood, unexplained weight loss, fever, severe pain, or a major change from your normal, do not just wait it out. Ongoing bowel changes can sometimes reflect more than a food choice. Get medical advice. Remember the simple version. Shape is timing data. Formed, soft, easy-to-pass stool is usually the calm middle. Looser stool can mean things are moving too quickly. Drier, harder stool can mean things are sitting too long. But the real warning is the pattern that keeps returning and does not match your normal, especially repeated hard pellets or persistently thin, flattened stools. Document it. Track dates. Take a photo if that helps you explain it clearly. Then bring it up with a clinician instead of guessing. Save this guide because the first quiet signal may show up before anything feels serious.